For the scenario that I was given, we have Sarah Parker. She's a 45-year-old physical therapist. She's been diagnosed with adhesive capsulitis. She's now coming to PT. She has trouble with putting objects on high shelves, playing tennis, reaching overhead, and difficulty reaching behind her back. Her right shoulder stiffness pain is a 4 out of 10. She reports that she compensates with her left arm and notes that her left shoulder has become fatigued, but it's not painful. Here are her objective measurements and short-term and long-term goals. In the non-op protection phase, you want to make sure that you educate the patient and provide information about what to expect regarding the stages of healing. You want to instruct the patient on safe motions, including body mechanics. You want to control the pain, edema, and muscle guarding. You can do that with e-stim, phonophoresis, ultrasound, ice, and heat. And also you want to make sure in this stage if there's any increased pain or irritability in the joint, you want to make sure that you modify the treatment. So we're going to start off with passive range of motion in all ranges and make sure that that motion is pain-free. And if it decreases, then we can go up to active range of motion. But for now, we're going to make sure that we stick with passive in all planes. So Sarah is restricted in external rotation to about 10 degrees in abduction, so we want to focus on that. And we want to make sure that she is not having any extra muscle guarding, and we want to monitor the patient and make sure they're doing okay during this time. The next thing that we're going to do is address body mechanics. So you want to make sure that she fixes her rounded shoulders and she flattens her back out to the chair. You want to make sure that her head is lifted. She's not looking down anywhere. So some interventions that we did, I made sure she reached for the ball with a straight. We started out doing table slides for shoulder flexion. She wasn't strong enough to actually move the towel. A way to progress this is wall slides, and a way to decrease it could just be passive range of motion. You want to make sure you look for shoulder hiking in this. The next thing that we did was shoulder abduction. A way to increase it is to lean into the arm more, get a little bit more range. And then to decrease it, you could always go back to passive range of motion. Make sure she's not actively moving the arm. The next intervention that we did was pendulums. I chose supported pendulums just to make sure her pain was okay at first and that she wasn't doing any excessive movement. We made sure to keep her trunk flat and engage the core. And then we progressed it to unsupported pendulums. You want to make sure that they're not moving the arm excessively and they're making sure that gravity is doing the work properly and it's not the actual muscles around the shoulder. The next thing that we did was scapular clocks. This is going to work to stabilize the scapula and make sure that she's not doing any excessive movement during the protection phase. So this is just getting a little feel for the scapula and make sure she's not using her scapula more than she should. The next thing that we move to is pulleys. So this is a way to have an active assist for the patient. So if the patient has weakness or increased pain or decreased joint mobility, you want to put them on the pulleys and make sure that they can get that full range that is needed, especially for her because she still has to go to work, she needs to play tennis, and you want to make sure that you address it as soon as possible. So some things to look for during this treatment is their wrist. A lot of times a patient will bend their wrist and it will just be uncomfortable, so to make sure that that doesn't cause any extra pain, you want to make sure that you fix it. And then a way to progress this is to you can straighten the arm, and then you can also make sure that they have more increased range. This is just a little bit for stretching rather than strengthening. So here she is straightening the arm, and we're going to go into abduction, making sure that the thumb is facing up while she's pulling upwards. So in the next phase, we have controlled motion. In this phase, we want to make sure that we control the pain, edema, and joint infusion as well. You can start with some passive joint mobilization techniques. The first thing that I did was stabilize her scapula and make sure that the patient was comfortable. And then we started with some external rotation with the wand. So in the controlled motion phase, you can start moving the joint a little bit more. She should have a little bit of laxity due to previous treatments. So we're going to do this, and then a way to progress that is to just have it unilateral like here. And then also in this stage, we make sure to add some joint mobs. So we're going to do a posterior lateral glide to make sure that we have more external rotation, and then an inferior glide as well to work on that abduction. So here we're just monitoring the patient and making sure everything is going good, adding the joint mobs in. And the next thing that we're going to address is the strengthening of the actual joint. So we're going to make sure that we start with isometrics. A way to challenge that would be you could do it manually, or you can add a weight, but we're not there yet. Or a way to decrease it would be also manually. In this, you want to also look for the patient not like contracting their whole body, but just contracting the actual shoulder muscles, and you want to make sure that they know that you just want a slow contraction, minimal, submaximal contraction. And we're going to do this 4 ways. So we're going to do flexion, extension, abduction, and adduction. The next thing that we're going to do is an external rotation stretch. So right now we're just addressing body mechanics, making sure her trunk is stable while she leans forward and no excessive pain is given at the time. So we're just going to monitor her and make sure that's okay. And then a way to progress that would be to add an extra block and put a towel over it. You just want to increase the range, so as she bends down, you can tell that she's getting definitely more range, and we're making sure that it is also pain-free. So you want to make sure that you note that. And then a way to decrease it would be passive range of motion. So the next thing that we're going to move into is quadruped. So this is good for putting weight on the actual shoulder joint. And in this phase, you want to make sure that they are doing movements correctly, because now you're going to get into that more range. And then you can add perturbations to make it a little bit more difficult. And also in this phase, you want to address any proprioception or challenges that she might have. So in this case, we just used a cone. And then the next thing we could do is add a Bosu ball under her, and she's just doing light weight shifts to get a little bit of weight into the capsule. She can also be taught self-mobilization technique. During the return to function phase, you want to make sure that you start off with a little bit of stretching and make sure that she doesn't have any increased pain with her movement. In this one, we chose doorway stretching, so you want to make sure that her shoulders are stable and that they're both even while she's doing this. You don't want to have any excessive movement. You just want to make sure that she steps forward and steps back. A way to progress that is a corner stretch. This way you can get a little bit more deeper. You can still make sure that she's stepping forward and stepping back. That's a way to make sure you can test her pain or not. The next thing that we moved into was wall walks. So with this, you just get a TheraBand. A way to increase it would be to change the color of the band. So in this case, I chose red, but for other cases, you could have a little bit thicker of a band. So she's just gonna go slowly up the wall. This is gonna help with tennis and dressing and making sure that her ADLs are doing okay as far as combing your hair or reaching behind her back. So you want to make sure that this is slow and controlled, and that she doesn't have any excessive movement or pain. You can always widen the legs to have a bigger base of support while doing this, because it is challenging to the patient. The next thing that we moved into was TheraBand. So this would be strengthening of the shoulder joint. So I chose yellow for this just to make sure that she didn't have any increased pain. So you want to make sure that their shoulders are even, and you also want to address that you want the patient to squeeze back here in the rhomboid area. And I chose to stand behind her to make sure that everything was level. And then a way to increase that would be go to a red band. And in this case, everything was fine, so we moved to horizontal and diagonal as well. So this is just getting every motion in the joint moving and strengthening while everything is controlled. As you can tell, she has gained a little bit more range of motion back. She's doing all these exercises well. One thing that I did notice with her is that her right shoulder was a little bit, not painful, but it was hard for her to figure out how to stay upright because she was leaning over more into that shoulder. So we switched sides to see if it was better. So then whenever I noticed that she wasn't, I made sure to stand behind her and do a little bit of verbal, tactile cueing. She also has mirrors in front of her so she can see what she's doing, because you want to make sure that every movement they have at this point is correct, since it is return to function. So you shouldn't have any extra impairments. So the next thing that we moved into was an internal rotation stretch. So we just progressed it a little bit. So all she has to do is pull on the towel and get stretched in there. And then the next thing we moved into was an external rotation stretch. She's been doing these in the other phases, so now this one is a more progressed stretch. After this, we moved into strengthening of the shoulder muscles and rotator cuff muscles. So we made sure to stabilize at the shoulder joint because sometimes it's hard for patients to understand the movement at first. So she was doing everything completely well, so I made sure to let go and let her do it on her own. So this is going to help her with tennis. And then the last thing that we moved into is actual tennis drills. In this case, we just used the racquetball room at the gym, but we made sure that she had every motion that she needed to return back to her sport. For post-op management, they would have a manipulation. So this happens when the progress hasn't been met. The therapist would start off with passive range of motion and Therex, and that's done while they're in their recovery room. You want to make sure that the arm is kept at abduction and external rotation, since those are the most impaired motions, and the patient might be required to keep that arm in that position for up to 3 weeks. And you want to make sure that you followed the same non-op treatment as you would before. So everything that we've done in this video, you could start off from the very beginning and follow that protocol all the way down. And also make sure you look for pain, inflammation, and tightness to make sure you wouldn't have to send them back to the doctor.